So that's the kits that we're using, the ORAcollect. So why are we using saliva when we already have blood? It's everywhere. You know, it's easy to take. Well, sort of. So I won't go through all the different uses, obviously, you know, all that. So we introduced saliva testing in 2014 using these kits. Easy to collect. Our cohort is autistic children, children with ID. So it's very difficult to get a blood sample out of these kids. You know, much rather have a saliva kit collection. So, you know, you can do it in the home, you can do it in clinic, you can do it out in the country, and you can do interstate. We just got samples from Fiji the other week. And you know, the quality is really good when they're in transport. We transport through Australia Post, and they're stable for about 2 months. So DNA yield is sufficient for microarray testing, which is what I do, and Fragile X testing, both PCR Southern's Prader-Willi syndrome testing, which is more of an MLPA-based test. So what's in a saliva sample? Well, what's not in a saliva sample? It's more the question. Human lymphocytes, fibroblasts, as we know, bacteria. I'm not so much interested in the bacteria. So 8 years of BCGS saliva microarray testing, 23,000 tests. So we've done quite a few. It sort of builds up over time, sort of unexpected. Same clinical utility as blood. Do we get the same sort of abnormality rates when we're using saliva? And also compare cases where we've done both a blood and a saliva in the same patient. Very hard to do that because these patients just want to have a saliva, they don't want to have a blood. So we got around that in a tricky way. And technically the same as blood. So we'll look at the DNA yield, quality, the failure rates as well for us.